guys, Charlene Ortiz here, and welcome to your workout today. I wanted to upload a video to show you some really great lower body exercises that you can do to help strengthen your hip, your knee, and your ankle joint, and to also challenge your balance and your stability. I wanted to do this video because unfortunately I got sick last week. I had a really bad fibromyalgia flare-up, and I did want to put something out several days ago, particularly the video on exercise and addiction, and that will be out in the next few days. But in the meantime, I wanted to give you guys a workout that you can do and that you can practice and work on until I do my next exercise video, because a lot of the movements I'm going to be doing today are going to be part of that workout. So what I show you today, I would really love for you guys to try to practice these movements throughout the week, so when we go on to that workout, you'll feel comfortable and you'll feel confident that you already know these movements very well. All right, so let's go ahead and get into our workout. Okay, so the first movement that we're going to start with is just a basic squat movement. All of you have heard of a squat and you've seen it done, but many of you probably haven't seen it done properly in many cases. And so I wanted to discuss the appropriate way to do a squat and why it's very important to maintain that position when you're doing the movement, and a lot of the mistakes that people make when they perform a squat that could put excess and unnecessary stress on their joints, particularly your knee joint when you're doing the movement. So for any of you that have been watching my videos since the beginning, you know that before we begin, we always start with our neutral spine and get into our transverse abdominis activation. So I'm going to give you a lateral view, a side view of how I'm doing the movement first. And I'm going to bring my shoulders back, get into my neutral, pull my belly button back in towards my spine, activating my transverse abdominis. And I'm using my little purple ball here today. And if you don't have your little ball, that's okay. You can still do the movement without it, but it just will help to keep your legs in the appropriate alignment while you're performing the movement. And if you haven't seen my video, How to Build a Home Gym for Under $50, there is a link in the description below where you can purchase one of these small balls. So I'm going to place this in between my knees. And when you're doing squat form, the first thing that you need to remember, aside from neutral spine and keeping that transverse activated, is you always lead the movement with the glute. The knees should never come forward when you're performing a squat movement. And as I'm leaning my upper body forward, that's helping to counterbalance me so that as I'm moving my butt back, I don't fall backwards. So it's just a slight lean forward. It's not, you know, all the way like a real deep lean. We just want it to be just at a slight angle as we're doing the movement. With the squat form, as with many other lower body exercises, some that we've already done, and pretty much all the ones that we're going to do in the future, you want to make sure that you're putting pressure through the heel of your foot, because that's going to help to activate the hamstring and the glute when you're performing the movement. And you also want to make sure that your knees are staying apart and they're following the alignment of your little toe. And again, we're maintaining our neutral spine, and that also includes what my neck is doing. Oftentimes I'll see people doing squats and they'll have their neck up like this, and it's because they want to see themselves doing the movement, make sure they're doing it properly. But as you can see, that gets you out of neutral spine, and neutral spine begins from the bottom of the skull all the way to the sacrum. So the neutral spine needs to be maintained throughout the whole spine. So I'm going to give you a frontal view of the movement so you can see some of the common mistakes that people make when they're doing squat form. Often people, when they come up from their squat, will bring their knees in together because the inner thigh, your adductor muscles, are not strong, and that's very common for a lot of people. So using the ball and squeezing it will, number one, keep you from bringing the knees together. Number two, cause you to have to engage your inner thighs in order to keep the ball, you know, in between the knees placed there. So when you're doing when you're performing the movement, it's the reason why it's so important not to move those knees forward is because whenever something moves away from your body, it takes on the most stress from gravity. So for example, when you go to the grocery store, you don't carry your groceries home like this, right? You carry them in close to your body. And that is because when it's close to your body, there is no stress from gravity on your arm. And so anytime a limb moves away from your body or a joint moves away from your body, it's taking on that stress from gravity, and we don't want that. What we want are the muscles to move away from the body, from the torso, and we want the center of gravity to go straight through here. And that way the knees are taking on minimal stress, and the glute, the hamstring, the quadricep are taking on the stress, which is appropriate because we want the muscles to take on the stress and not the joint. Also, people often have a hard time engaging their glutes and knowing and understanding how to engage their glutes when they do a squat movement. And so they will overcompensate with the quadricep muscle. So that's why I will always instruct my clients to push through the heel of the foot, put pressure through the heel of the foot as they're doing the movement. Now, when you're first learning how to do a squat movement, I will sometimes put a chair or a bench behind my client because when you're pushing through the heel of the foot, people will lose their balance. It's very common to lose your balance because your body's just not really used, to being in that position and having to counterbalance you that way. So that's why I like them to have something behind them. So if they do lose and they fall a little bit, they'll have something right there to land on. Or you can practice it holding on to an apparatus or a good stable surface that'll help you with your balance and stability. So let's do just a few repetitions of the basic squat form, and then I'm gonna advance it right away from there. All right, so my little ball is going in between my knees. I am squeezing the ball and I'm engaging those inner thighs. The first thing I'm doing, getting into my neutral spine, activating my transverse, and let's do 10 repetitions of this movement. So leading with my butt, and as I come up, I'm pushing through the heel of my foot, and I'm standing in an upright position. That is my ending position. Another thing you want to avoid is this. You don't want to let your hips swing forward when you're doing the movement also. For two reasons. Number one, the muscles, if you stay in this position and don't swing forward, the muscles still have to engage and contract slightly, which will make them work harder. Number two, when you swing forward, that's going to take you out of neutral spine and put unnecessary and inappropriate stress on your low back that we do not want. So, all right, let's just do a straight 10 repetitions. I promise I won't interrupt this time. So neutral, abs pulled in tight, and again, pushing through the heel of the foot. And don't worry about your range of motion and how far down you can go, because that will all depend on how it feels on your knees, how it feels on your back, how it feels on your hip. So if your range of motion is real limited, where you can only go this far, but you're able to maintain neutral spine in the appropriate form, that's fine. Don't worry about it. I would rather you maintain the appropriate position than try to go down deeper and you're getting out of neutral form, you're getting out of your position. All right, let's do one more. I think that's been more than 10, but that's okay. Doing a few more won't hurt you. All right, so now I'm going to demonstrate a one-legged squat. And the one-legged squat is the same as the two-legged squat, except you're just doing it with one leg. So, but it's very important that you practice the bilateral or the squat with two legs before you go on to the one-legged squat, because the rules and the movement, the position, all of that is the same, but at just a much more advanced level. So make sure you are practicing your squat form, you feel comfortable with the squat form, and you feel confident about performing it and how to perform it before you go on to the one-legged squat. So because you're only using one leg, it's going to require a lot more stability, a lot more balance, and a lot more communication from your brain and from your neurological system. And that's what I like about it, because it makes you sharper, it makes your reflexes a lot faster, and it makes the communication between your brain and the muscles a lot sharper. So that's why I like challenging your body to do stuff that's difficult to do and maintain the appropriate position, and putting yourself in an unstable situation, but keeping yourself stable. Okay, so we're gonna start with our neutral spine, shoulders back, abs in tight. With this exercise, I highly recommend that you do start holding on to something for balance, something stable, because this will be very challenging for your balance. And the positioning of the opposite foot that's just kind of hanging out and chilling, it doesn't matter if you put it in front or behind. It really has to do with where it feels comfortable, what your comfort level is, number one. Number two, your ability to maintain neutral spine while you're doing the movement. So some people, if they put it behind them, they realize they lean forward too much. Or if they put it in front of them, they arch their back too much. So you determine where you would like that foot to be. And like with a lot of other things that I've taught you guys that are new, I always suggest that you do these things in front of a mirror. So obviously you can watch yourself and make sure that the form is appropriate and you're performing the exercise properly in order to, number one, not hurt yourself, number two, get the most effective result from that exercise. Oh, in my neutral, my abs are pulled in nice and tight. I'll do a quick demonstration. So it's the same as with the basic two-legged squat. I'm just going into squat movement, and I'm only using one leg. And now I'm going to put the foot behind me, just so you can kind of see both ways. Okay. I personally like to have the foot behind me just because I tend to have more stress on my low back. My low back does tend to curve a little bit excessively, so that's why I like to have my foot behind me, because I tend to arch my back too much and round my shoulders if the foot is in front of me. So that's my personal preference, and again, you'll decide which is your personal preference. So from the frontal view, I want you to also watch what's going on with my knee, with my leg, and my body position. When you're doing the movement, one thing you want to avoid is letting your body go all over the place and your hip kind of dip from one side to another. In the beginning, that's going to be natural because you're just learning it, your body hasn't done it before, or maybe you have at one point, but it's just been a really long time. That is normal, but we don't want it to be too excessive. And that's why I recommend you hold on to a stable surface when you're performing the movement, so that way your body can learn how to do the movement in the appropriate alignment while you're holding on to something stable. And you can maybe let go for a couple repetitions, and if you lose your balance, you grab onto it. Again, wherever you're at, what your comfort level is, but it still needs to be a challenge for you. So let's do a set of 5 on each leg, although again, in general, I always recommend 10 to 15 is kind of the standard, but just for the sake of time, today we'll do 5 on each side. So in my neutral, my abs are pulled in nice and tight. All the same rules for the one-legged squat are going to apply as it does for the two-legged squat. I'm putting the pressure through the heel of my foot. A little trick that I teach my clients when I'm teaching them these movements like squats, lunges, is to look at your foot. If you can see your foot, you don't have to look at your foot the whole time, but if you can see your foot while you're doing the movement, that means your knee's not coming forward. If you look down when you're doing the movement and your foot disappears, your knee's coming too far forward. So make sure that you can see your foot throughout the whole movement. Now I'm going to do the other side. My left leg in, shoulders back, abs in nice and tight. And I'm going into my squat with my upper body slightly lean forward. And again, I'm pushing through the heel of the foot to keep to make sure I'm engaging my glutes and getting the glute more involved with the movement. It also helps if you stare and keep your gaze at one point, because when you look at one point, your body is more likely to stay in that same position. Because when you turn your head, it's very common for your body to lose its balance. And the reason is because wherever you're looking, your body wants to go and follow you where you're looking, which is a great design because we want the rest of our body to follow our head. So if you're looking this way, your body's gonna think, oh, we must be going over here, so let's start to go here. And that's why when you're performing this movement, if you start looking around, it's very common to lose your balance. So just finding a spot to stare at the floor while you're doing the movement will help you to maintain balance as well. All right, let's go ahead and move on to our next exercise. I'm going to be using this band right here, or you could use a band like this as well, okay? Whichever one is most convenient for you. And again, make sure that you do choose a resistance that is going to challenge you. Don't always go for the lightest one right away. So you want to make sure by the end of the set you are feeling fatigue setting in. So I'm going to place this between my ankles. Now, if you want to do this sitting down or holding on to something, that's perfectly fine. I want to make sure that you don't hurt yourself before you even go into the exercise. So definitely, if you're a little challenged in your balance and you need to hold on to something, please definitely do hold on to something. This exercise is a wonderful exercise for anyone that has a weak hip from injury, surgery, a weak knee, or as well as, again, a weak ankle. When I was working in a physical therapy office, this was like a staple exercise that we did because it works pretty much every muscle in the lower part of your body. And the other leg is also working hard to stabilize you while you're doing the movement. And because there's really no movement in the knee joint and the movement in the hip joint is very minimal, it's also not very stressful. So it's a little less invasive to do. However, it's still quite effective in strengthening the muscles that surround the joint. Because when we're trying to strengthen the joint itself can't get stronger. We're focusing on strengthening the muscles that surround the joint. So if someone says, I need to strengthen my knee, well, in theory, you cannot strengthen your knee. You strengthen the muscles that surround the knee. But obviously we say, you're not wrong in saying I have to, strengthen my knee, but that's really what we're talking about, is strengthening the muscles that surround the knee. So the first movement I'm going to do is just going to be a hip flexion where I'm bringing my foot forward. This leg on the other side is staying slightly bent. And even this knee I have slightly bent right now, just because that I feel a little bit less pressure on my knee when I do that. If you want to straighten it all the way, that's fine too. But I just personally keep it slightly bent because my knees are a little achy as well, because I am getting old. I'm not 25 anymore, and my body reminds me every day. And then the next movement is going to be out to the side. And this is going to be training your abductor muscles, as well as your glute is going to be significantly engaged when you're doing this movement. Now, when you're doing the movements, you want to make sure, like everything else we've done, that your body is staying nice and stable, that you're not leaning into the movement while you're performing it, which is very common. A lot of people will have a tendency to do that until, you can teach your body how to keep it stable while you're doing the movement. Also, if you can do the movement with the leg hovering the whole time, that's fantastic. That's the goal. But if you do need to stop in between repetitions, like you're not quite ready for that, and just do a brief second, literally like a second, a brief rest, that's okay. If you do need to start that way, that's fine. And then we're gonna go backwards for a hip flexion. So again, I'm in my neutral, shoulders back, abs are nice and tight. With this one, it is very common for people to excessively arch their lower back, and that is something you want to avoid when you're doing this movement, because again, it's going to put excessive stress on your low back, take you out of neutral spine, compress the vertebrae, and that's really bad. We certainly don't want that. And so if that means that you have a limited range of motion, that's fine. Don't worry about it. As you get stronger, more conditioned, and more flexible, your range of motion will increase. Now, the abductor one, the inner thigh, is a little tricky sometimes for people. You can perform it when it's just standing, just standing straight without tying the tubing to anything, and I'll show you what I'm talking about in a second. And you can perform it just, standing in a straight position and bringing the foot kind of across your body. Although it is going at a slight angle, it's not going directly across. It is going at a slight angle forward. However, it is straining the inner thigh. But some people with this short band right here, that movement doesn't feel natural, doesn't feel comfortable for them, or maybe it hurts your knees or what have you. So you can use the long band right here, and then, you know, you just tie it into a knot, and you can then, well, actually what you would do is you would find a stable apparatus like your kitchen table, or, you know, something that's fairly heavy, and then you would tie this, you know, around a low apparatus, and then you would just step in it like that, and whatever it's attached to, you know, you just keep your body stable. And then, I'm sorry, actually, let me demonstrate with this foot. So whatever it's attached to, you would just bring your leg in like this while the band is attached to a chair, or, you know, whatever it is you're using. And with the tubing, you can also do that too by shutting the tube into the doorway. And I'll actually do that option when we do our workout, just for the sake of time today. I'll show you, you know, how you would do that, like with the door jamb and all that good stuff. So, but you can, again, attach just to a stable apparatus and just do it like that, as opposed to doing it across your body. So it's up to you, whatever you're comfortable with. All right, so let's do a set, just one set on each leg. And this exercise, if you're doing like 3 sets of 10 to 15, it does take a few minutes. It is a little bit time consuming. And so that's why I'm only going to do 5 repetitions on each leg, just for today. And you can perform them with me if you like. So let's start in our neutral spine, our abs holding nice and tight. I'm going to start with the forward movement with the hip flexion, and bringing your leg just straight forward, and just go as high as what feels comfortable for you. And as far as helping you with your balance, use the same rule that you use with the one-legged squat, where you stare at one point and you just keep your gaze there, and that will help to keep your body stable. All right, so I'm going to go straight onto my other foot, shoulders back, abs in tight, and this leg, the supporting leg, the knee is just slightly bent, just slightly, and that will help to engage the glute immediately when you just go into a very slight little bend in that knee. And my belly button staying pulled in tight. I'm trying to keep my body stable as possible. Now we're going to go lateral, and I'll start with my right leg out to the side. You're keeping your body stable. Remember, you're not leaning into the movement. And if you do need to tap the floor in between repetitions, if it's too difficult to hover, that's fine. Let's do the other side now. Shoulders back, abs in tight. And I constantly remind you about your neutral spine and your transverse abdominis, because if you're not used to it, you just forget. You know, it's just, everybody does, you know, in the beginning, and that's normal. So that's why I constantly say it, so that it starts to become normal and natural for you. Now, if you're performing these exercises with me right now, you're probably noticing the leg that is supporting you is really starting to fatigue and burn and get tired as well. And that's great, because again, that's one of the goals of this exercise as well. All right, now I'm gonna go the adductor movement, which is the one straight across my body. And at this point, if you wanna perform that with the long one, go ahead and just find an apparatus or something that you can tie the tubing to, and then you would just put it on your foot and then bring your foot in, you know, like that. All right, so I'm just gonna do the crossbody one. Shoulders back, abs in nice and tight. Also, keeping your neutral spine and keeping your transverse abdominis activated will help you to balance as well, believe it or not, because it does provide a good stable foundation for your body. And for those of you that have seen my video on improving posture, abdominal strength, and reducing back pain, if you did do that test, you know, with one of your friends or your husband, your roommate, whoever, you did notice a significant difference in your stability, your ability to anchor yourself when your abs are engaged and your neutral spine is in the appropriate position. Now we're going to do the other side. So it's just straight out to the side, 5 repetitions. Again, it's not completely straight to the side. It is kind of a little bit of an angle in front and also to the side. My belly button stays in. I'm not letting go of that transverse abdominis, and relax. All right, so that is pretty much it. And these 3 exercises, like a lot of the exercises that I've shown you so far, are going to be foundational movements that we're going to continue to build on, continue to progress and advance. So between now and when I upload my exercise video next week, and that is going to be more of a full body workout where we're just going to do a circuit where all your muscles are going to be engaged, and it's also going to be really great for burning some calories because it will keep your heart rate elevated throughout the workout, because I just want to show you how you can combine these movements together and do a little circuit if you want to. But I like to teach a lot of these movements kind of segments at a time to give you time to practice and get good at it, get comfortable. And then when we get to a full body workout, then you feel like, okay, I know how to keep my neutral. I understand how to engage my transverse. I know how to squat properly. I understand scapular retraction, all those good things. So when we get to the circuit, the actual little workout that we're going to do, you'll already feel like, okay, I already understand the basics, and you'll be able to pick up the more advanced versions that we're going to do. You're going to be able to pick that up a lot easier. So my next video is absolutely going to be the video on exercise and addiction. Again, I am feeling better, but the unfortunate thing about being someone that is doing a channel like this that has chronic illness is every so often I will get a flare-up, and unfortunately that is unpredictable. But I did want to give you guys something that you can do and work on and practice, you know, in the next week till we get to our next exercise video. So, all right, guys, as always, thank you so much for your time and attention. If you really enjoyed this workout and you felt it was a good benefit to you, go ahead and like it. And as always, definitely put a comment below if there's something that you would specifically like to see me do, any specific research, topic, exercise, injury, or weakness that you might have. Let me know so that I can be doing exercises and providing content that is catered to you and to what it is that you guys want to see. So remember to always protect yourself, take care of yourself physically and emotionally. And don't forget, your health is your most valuable asset. Invest in it. Bye-bye.